Hi, my name is Lori Jeffers, and I would like to talk to you today about Medicare reimbursement for advanced practice nurses. I'm currently a student in the doctoral program at Duke University School of Nursing. I graduated from Duke in 1982 with a Bachelor of Science in Nursing degree. I've been a nurse for over 30 years in a variety of settings, the last 15 of which have been spent as a board-certified family nurse practitioner. For the last 11 years, I've had my own practice called Well Woman Care, where I focus on the preventive needs of women across a variety of ages and stages of life. My youngest patient is 9, and my oldest patient is 92. I have about 700 patients that I take care of. I became a Medicare provider under my own NPI, or National Provider Identifier, when I started my practice in 2002. Under Medicare guidelines, 4 different categories of APRN providers are recognized. These include nurse practitioners, certified registered nurse anesthetists, certified nurse midwives, and clinical nurse specialists. Our Duke DNP program consists of many of these professionals. In fact, I'm very proud to be in this program among the best of these clinicians. Together, we represent over 267,000 nurses in advanced practice across the country. And together, we use our highly skilled expertise to take care of thousands of patients on a daily basis. Every day, we put thousands of patients safely under anesthesia, and every day we treat and manage thousands of patients with chronic illnesses such as hypertension, diabetes, asthma, and a variety of other conditions through our practice in primary care settings. Every day, hundreds of infants are safely delivered by certified nurse midwives, while clinical nurse specialists play an important role in hospital settings through their focus on quality and safety initiatives, which work on improving patient care. However, in spite of these facts, and in spite of the level of expertise we represent, Medicare reimburses us only 85% of the physician payment schedule. Importantly, numerous well-done studies starting in 2000 and continuing through 2011 reveal that patient outcomes and patient satisfaction are equivalent whether patients are taken care of by physicians or nurses in advanced practice. These studies have looked at both inpatient and outpatient settings and have found very similar and favorable patient outcomes. On the outpatient level, comparison of glucose, lipid, and blood pressure levels, we see equal outcomes between advanced practice nursing care and physician care. On an inpatient level, when we look at length of stay, mortality, hospitalization rates, they're all similar across physician and APRN care. However, the 85% reimbursement that APNs currently receive from Medicare implies that we somehow give 85% of the care. As NPs, we do not leave the room when we have completed 85% of an exam or written 85% of a prescription. CRNAs certainly don't stop administering anesthesia when a patient is 85% under. And certified nurse midwives don't abandon their patient when she's 85% delivered. Receiving 85% of total reimbursement amounts to a 15% discount on our care. This implies that there's somehow a difference in the quality or outcome of our care, even though a thorough review of the literature reveals that this is clearly not the case. So there's no real reason for this 15% discount, and there appears to be no evidence to support it. This issue becomes highly relevant when we consider the context of the changing landscape of our healthcare environment. How is the healthcare of the future described? The Institute of Medicine, which is a nonprofit, unbiased arm of the National Academy of Science, has established 6 main goals for a successful healthcare system of the future. These goals include care that is safe, effective, equitable, efficient, timely, and most importantly, the patient needs to be at the center of this care. However, in order for these goals to be met, new models of care delivery need to emerge. Within this context, the IOM recommends that all APRNs must be able to practice to the full extent of their education and training, and that we must be full partners with physicians in redesigning and delivering this health care. Getting equal reimbursement for our services is a logical first step in this process. As APRNs, we are the fastest growing segment of the primary care professional workforce. We are expertly trained to manage chronic illness and preventive care. We are ideally positioned to address the changing landscape of healthcare and to address the predicted physician shortage over the next several years. We are 250,000 strong and growing in numbers every day. We have found our voice, and we do not want our care to be discounted any longer. Thank you.